Hey, good morning. It's Wednesday, February the 22nd. I'm Dr. Steve Stites, Chief Medical Officer here at the University of Kansas Health System, and welcome back to Open Mics with Dr. Stites. They say age is just a number. Those people never grew old, actually, because age is more than a number. But that was never more true for the man than for the man you're going to meet today. Most doctors would have denied him a life-saving procedure because of his age. But as Alexis Del Cid shows us, some rules are indeed meant to be broken.
Jim, how are you?
I'm doing good, very good, thank you.
That's fantastic.
Fantastic is not the word Dr. Zubair Shah would have ever used to describe Jim Wagner in August of 2021. Not by a long shot.
When I saw the echo, my thought was, how is he still alive?
Let's be honest, how is he still alive is the last question you ever want your doctor asking about you. But here he was, with a heart apparently only functioning at 30%. His thickness in the heart so severe, the cavity size so small, Dr. Shah told them he'd never seen anything like it.
And so you're just like numb, frightened.
On top of that, Jim and his wife Marlene were stunned. They had only made the appointment and driven to the University of Kansas Health System from their home in Nebraska to meet Dr. Shah to simply make the case for getting into one of Dr. Shah's clinical trials.
Immediately when I saw the images, I said, Jim, let's not talk about trial. This is something more serious than trial.
And he basically told us that of 100 patients, I was the worst one he was treating at that time, and that my only hope would be a transplant.
A heart transplant, and Jim was about to turn 74. His age would typically be a big red flag for many doctors who would say his age automatically ruled him out as a candidate for a new heart.
Thank goodness Dr. Shah didn't look at my actual birth date. He looked at me as a person and didn't just look at my age.
Dr. Shah says he looked at Jim's health, which was otherwise excellent. He'd been exercising an hour a day for more than 50 years. He worked full-time, and Jim ate a pristine diet. And in Dr. Shah's book, all of these factors made Jim the perfect candidate for a new heart.
Jim Wagner is joining us remotely now. Good morning, Jim. Pleasure to meet you here in the program.
Good morning. Nice to see you.
Also joining us remotely is Dr. Zubair Shah, transplant cardiologist and director of the cardiac amyloid program here at the health system. There's a little bit of a hint of what's going on. And also here in the studio is Dr. Matt Danter, Jim's transplant surgeon, who is also the health system's surgical director of cardiac transplant and mechanical circulatory support. Welcome to you all, and thanks for being with us. Jim, you've had your new heart for about a year and a half. Has it changed your life?
Well, looking back, I came down to see Dr. Shah August 28th of 2021, and you heard what he told me at that time. And so we came back to Lincoln, picked up some things, and I was admitted into the hospital on August 30th. 45 days later, I walked out of the hospital with this new heart. And I was just telling Dr. Shah that night, my daughter lives in Kansas City. I went home and I grilled him salmon. And looking back, it's kind of like my life I took a sabbatical from life where I had a bit of an intermission. Because even though I was diagnosed in 2018, I was largely asymptomatic until the summer of 2021 when I started struggling with my workouts. I didn't know at the time I was probably going in and out of atrial fibrillation. I was working on some continuing education via internet. I'd go back to my office from the Y, and I couldn't stay awake. So the fact that, it kind of progressed rapidly, but I had the transplant and recovered rapidly. So it's like my life was normal, then it wasn't normal, and now I'm largely back to normal because I really haven't had, many major issues with this whole ordeal.
Now we're going to talk about some medical questions, but first I need to ask, how good's your grilled salmon?
It is excellent. It's fantastic.
I need to try that. I love grilled salmon. Okay, so now, when you went to this appointment, you thought you were going to be in a research study. But suddenly that turned, and it turned in a pretty dramatic way. What was your reaction when Dr. Shaw said, you need a new heart, not a research trial?
Well, it was shocking, and it's even more shocking when I tell a little bit more about my previous history, because I was being treated by a cardiology group in Nebraska. And I actually saw that cardiologist, who was an expert in, quotes expert, an alleged expert in amyloidosis, on July 2nd of 2021. I found my way to Dr. Shaw, as I said, August 28th. After my visit with my cardiologist in Nebraska, he gave me no indication of how sick I was, and he actually sent me home with a prescription of Lasix. And it's just the antithesis of what Dr. Shaw, how he treated me, because this doctor in Nebraska must have looked at my birthday, and he didn't even have the courtesy to tell me how sick I was. Probably should not have been driving. In any event, so yeah, to say it was shocking to say is an understatement. And again, thank God Dr. Shaw looked at it differently.
So, Dr. Shaw, it sounds like you were a pretty important figure here in Jim's life. Tell us what was wrong with Mr. Wagner's heart.
Yes, so Jim has something which was kind of relatively complex, what we call is wild type or age-related ATTR cardiac amyloidosis. What happens is we all have a carrier protein called transthyretin, short name TTR. And in some patients or in some people with age, this protein becomes unstable and breaks down. And these broken products, these breakdown products, build on the heart and cause heart to get thicker and thicker at the cost of the cavity, as well as make heart very stiff. So we have one of the biggest amyloid program in US, and Jim was at the severe spectrum of cardiac amyloidosis. Normal male adult's cavity size is 70 to 120 mLs. I think his cavity was just 25 mLs, very small cavity. And on top of that, heart was very stiff, and then his heart function had also fallen down. So to summarize, heart was barely pumping any blood out to keep organs alive. So as Jim said, he came to get into a trial. He had this amyloid, I would say, at least for 10 years. And he came to get into the trial. But when I saw his echo pictures, his ECG, I mean, this would not have reversed with treatment. And examination-wise also, he was in low flow state. So we had to admit him immediately to CICU, and I had a detailed conversation with him. And transplant is an evaluation, so we started evaluating him.
So really, normally the heart expands a lot when you get blood, and when it comes in your back, the left side of the heart kind of expands, then it can pump stuff out. In this case, what it sounds like is the heart couldn't really expand. So even when it pumped, there wasn't much to pump because it never really loaded. Is that fair?
That's exactly right. So the cavity is so small, it's not able to, when heart returns from the lungs, oxygenated blood, heart kind of expands and then squeezes back. His cavity was so thick, heart would not expand. It will not take any blood from the lungs, so blood will backflow into the right side. So it was a very difficult, very severe form of restrictive infiltrative heart failure.
So this sounds a little like my wife thinking I have a thick head sometime and I can't hear what she's saying, you know what I'm saying? And then I can't get done what I'm supposed to get done, and I think a thick head or something like that. So is there an age limit for transplant, or?
I mean, there is not a hard line. Generally, some programs stop at 70, some at 72. It has more to do with frailty, organ availability. And Jim was, we had done 72s, but Jim was 73, going to be 74. So it all depends on, other patient criteria also, how well they are, other organs, frailty, functional status. And Jim, as he said, was in excellent shape. There was no hard contraindication. I mean, age is, in my opinion, soft contraindication. Other than that, end organ function was very good. He was in very good shape. If Jim remembers, I made him walk also to see how good he is before I spoke about transplant. So to summarize, it's a soft contraindication, but we look at patients on individual basis. If there are no other contraindications, we can go up to 75, 76.
So I'm interested that, I do a lot of end-stage lung disease, work with some other programs outside here for lung transplant, but one of the things we preach is exercise, exercise, exercise. Do you think Jim Wagner was still alive because he had exercised so much, and that kept him much healthier to be able to handle the difficulty he had with his heart disease and set him up for a heart transplant?
Absolutely. He was in very good shape. And I'm certain that's why he survived this long with that low flow. And on top of that, he did excellent post-transplant. He went home day 8 and was, as he said, was helping to grilled himself salmon on day 8 and didn't even had pain. He was just taking Tylenol post-op. So all of this is because, in my opinion, he was in excellent shape.
Yeah, that sounds pretty good. So, Dr. Shaw, have you had Mr. Wagner's salmon yet? Have you had it? I've not. Dr. Wagner, have you had that salmon?
No salmon for me.
Okay, Mr. Wagner, I'm just saying. I'm thinking there's a salmon deficit here in the room. All right, Dr. Danner, you have transplant hearts for a living, and you transplanted Jim. You ever done this with a 74-year-old before?
Once before when I was at Vanderbilt, yeah. I think Dr. Shaw said it well. Age is a relative contraindication, and we were talking about it before the program that the relative age limits for transplant have not changed since I started medical school 117 years ago. So the realities are that we take the person as a whole, and I think we have adopted one of the strategies that one of my other mentors, another Dr. Shaw at Vanderbilt, said, which is, if not us, who? So that's our approach to it.
Yeah, and I think that makes a lot of sense because age can be a very relative number. But there's also a shortage of organs out there. So is it wrong to submit to transplant someone who's already been a little older than someone who's younger? I know that can be an ethical debate in the transplant community.
I don't think it's wrong. I think if we didn't have the multidisciplinary committees we have, and we didn't have the very thoughtful approaches to each patient as an individual, then you could question, transplanting every 74-year-old or every 76-year-old. But the scarcity of resources does make that a relevant conversation. But I think that particularly in the individual basis, you could make the argument the other direction too, that is it ageist to discriminate against a group of people solely based on their age when literally Mr. Wagner was in better shape than his heart transplant surgeon at the time of his transplant, other than his heart function. So,
well, there's something about how well you've taken care of yourself in order to be, because I'm with you. Age is just a relative number. I try to tell my kids that all the time. That I'm really not old. I'm just more wise. So, you mentioned taking a look at the whole person, not just the number. What are the concerns that you have, though, for people who are not 45 but 65 or 75 and thinking about transplant?
Predominantly, I'd say post-op recovery and preoperative failure, frailty would be the biggest one. So someone who isn't mobile, someone who is already relatively debilitated preoperatively is not a good candidate for a haircut even, you know what I mean? But but for someone who is fit and active and otherwise free of major absolute contraindications, things like smoking and diabetic control and these kind of things, then I think you take it as a case-by-case basis, really. But the fact that you live a healthy lifestyle and get to 74 or even older with a single system problem means that you've been taking care of yourself. So I think that it portends a very good outcome afterwards. The biggest concern that we all have for anyone who's a little more elderly is post-op recovery and ability to tolerate any complications. You know, we like to celebrate our successes and things like this, but we also have to recognize that someone who's 75 can't take and recover from a stroke the same way a younger person can, or even, you know, people with degrees of frailty don't respond and recover as well. So that's why it's very important to have a multidisciplinary approach and to ensure that we have input from our physiotherapists and our rehab physicians about the appropriateness and the likelihood of people being able to recover after a major operation.
So it's really about that, getting back mobilized and making sure you do get a quicker recovery or a rapid recovery so you don't have some of those difficult complications that can happen. Have we transplanted other 70-year-olds?
Yes.
Okay, so this...
Several.
And I bet they're all kind of have that same story as Mr. Wagner. I work hard at trying to stay healthy and stay alive, even up to the point of transplant.
Yes.
All right, so now, Mr. Wagner, just a couple of questions here. I'm going to assume you've been very active in the last year and a half since your transplant. Is that accurate?
That is very accurate. Like I say, I got out of the hospital 8 days. The next day, I walked in the hospital every day while I was waiting for my heart. I was in multiple rooms, and nurses would come in and say, well, I haven't taken care of you, but we see you walking all the time. So I walked even when I was in the hospital. Out of the hospital, I was back, you know, I was encouraged by all of you to exercise, which was not hard for me because I'd become an avid exerciser in the early 1971 when I got out of college. I worked out 6-7 days a week before transplant, and I'm doing that again, and you know, 40-50 minutes of cardio and trying to do some weights, and it's not work for me. I enjoy working out.
Now that is really amazing. We saw the picture of you working out. You're doing it 6 or 7 days a week. That's great. Do you still hold down a job too?
Yes, I've been in the insurance business. April 1st will be my 52nd year, and I still enjoy my clients. You know, I don't work like I did 10 years ago, but as long as I'm physically and mentally capable, I enjoy what I do and intend to continue doing it.
Are you ever going to retire to make salmon or whatever?
Well, I think we all retire, don't we? Like I said, I'll know when it's time, or someone will tell me. But I will say, I answer the phone at the office, and I think sometimes are amazed. They say, "You're still there."
Yeah. What are you doing? What are you doing? Yeah, I was talking to the nurse. Worked the same nurse for 20 years.
Yeah, sometimes they're hoping for voicemail, and they get me.
Yeah. I've been working with the same nurse now for 20 years. I said to her yesterday, listen, when I'm not very smart anymore, you have to make sure I don't hurt anybody, or you got to tell me that I don't do something dumb here. So there you go. All right, so listen, there's a couple of things I want to just point out here. So if you want to learn more about heart transplants here at the system, we're putting a link and a QR code up. Scan the code or go to the website bit.l/y/newheart in all caps. That's bit.l-y/newheart in all caps, or just scan the QR code. You'll learn all about heart transplant here, and you can see why Mr. Wagner has done so darn well. We've got a great team of people who are working around that. So, Mr. Wagner, last question. Have you made some lifestyle changes?
Well, I think another huge part of my fitness when I got down there, nutrition was also another major factor for me. My daughter actually got her master's and PhD at KU Med and worked in the integrative medicine department there. So when my son got cancer in 2011, he had non-Hodgkin's lymphoma. We really ratcheted it up. We had an apartment in San Diego. We cooked all his food, and largely organic. And my family did the same thing for me when I was hospitalized. Fortunately, my daughter lived just 10 minutes from the hospital. So I really want to shout out to Promotion and what she and we largely eat organic and eat as healthy as we possibly can. And I think that's a huge factor in all my recovery.
So you guys are really a KU family, and I bet you know the Rock Chalk chant then.
Oh, I've become a KU fan. Yeah, I say I graduated from the KU Med Center.
That's awesome. All right. Well, Dr. Shaw, I saw you shaking your head yes when you heard about lifestyle modification. Anything you want to put in there? Because I know you're a strong believer.
Yeah, I mean, I agree with Jim. You know, especially post-transplant, we expect patients to take excellent care of that organ. It's kind of an obligation. And I mean, healthy diet, low salt, low sodium, low fat diet, less carbs, and Jim has been doing that of his own. Generally, we have to educate our transplant. Once they get the transplant, they have appointments, and we educate them about healthy diet. We really have a faith in that, and he has been doing that by himself.
I bet. The first thing he does is have grilled salmon. I love, as I said, I love salmon. I'm giving up bacon for Lent, by golly. All right, so now, except for Sundays, I think I can do that on Sunday. The other thing I just wanted to touch base on, I'm 63. Can I be a donor? How old can you be a donor for a heart?
Again, there's a number of relative contraindications. 63 might be pushing it a little bit, to be honest, but it depends on looking at both the donor characteristics and then really often what your recipient characteristics are. Because if you've got a critically ill person who's literally on as much support as we can keep them alive with, then you would have a lower threshold for taking an organ that may or may not be what we determine to be totally perfect. And we've looked at, during the early 2000s and things looking at sort of marginal donors for marginal candidates and these kind of things. And what was born out of that was a lot of the Hep C stuff was actually, so the ability to take Hep C donors with the advent of new medications. So it depends. 63 though is maybe pushing it.
Okay, thanks a lot for that. I appreciate it. Glad to feel
for
that
heart,
way.
Anyways.
Oh, I got it. Listen, he's got this perfect looking hair up there and all that. Shaw, I think you and I should make him be a hair donor. I think you got to give us a little bit of support here. What do you think?
Absolutely.
All right. I'm sure our viewers have some great questions for our guests today. They always do. Get yours sent in to us now on YouTube, Facebook, Twitter, and the Medical News Network. You'll find links to those right here on your screen. Jessica will join us in a few moments with those questions. Next, let's check in with Dr. Dana Hawkinson, Medical Director of Infection Prevention Control here at the Health System. Doc Hawk, how are the COVID numbers looking today?
COVID numbers are unfortunately holding steady and really not decreasing too much. Active infections are still in that mid-20s range, but right now we have 51 total. Of those, 26 are active, still 5 in the ICU and 3 on the ventilator. Overall this week, though, Steve, we've had a higher proportion in the ICU than we've seen recently, unfortunately.
We're kind of stuck.
Yeah.
We're stuck between 45 and 55. Mm-hmm. Not loving the stuck.
No, I mean, I think we are saying this is probably the best measure of actual circulation of the virus out in the community, because we know the testing and case rates that are reported are probably not as accurate. But unfortunately, we are still seeing these people coming in to the hospital. And I got a consult for one of them yesterday. Again, all these people have significant comorbidities associated with that as well.
Yeah, I think, it is just a good reminder that even though we want it to go away, it's still here. Mm-hmm. It may not be what it was, but it's still a threat. The best way to keep yourself safe is vaccination, which we're going to turn to in just a moment, along with, if you're around a high-risk area, to go ahead and put a mask on. Yeah. Hey, a new study is reinforcing our belief earlier, Hawk, that ivermectin doesn't work. It came out in JAMA this week. Talk to us about that.
Early on, ivermectin was hailed as this miracle drug. I was skeptical. My hypothesis was that supportive data, the data that initially supported it, was found to be falsified and untrue. We wanted those good studies, that peer-reviewed studies. This is one more piece of that. They actually looked at higher dosing of ivermectin than they were using previously to help reduce chance of hospitalization and also help reduce days of symptoms. And what it found was that ivermectin ivermectin, even at a higher dose, had no effect, no benefit compared to taking nothing at all. So really supportive treatment for those, for most people is good. Obviously, if you're high risk, you want to get tested early, get treated with Paxlovid if you need to be. But ivermectin, really, this is one more piece just saying that it is not effective, and there really should be no use for ivermectin in this infection at all.
Still some good news out there, though, that the bivalent vaccination does continue to work, and actually some of the original vaccination continues to work too.
Yeah, absolutely, and we believe this is because of those memory B cells, which are creating antibodies, but also especially those memory T cells to help prevent that severe illness. Now, again, the vaccination maybe can help protect against infection itself, but that is only for several weeks after you get your vaccination dose. More importantly, you are continuing to have that T cell immunity. There is good data to continue to support that the bivalent, the current vaccines are still effective, but also even against these new variants, it seems that our antivirals such as remdesivir, Paxlovid continue to be effective as well. We know that the monoclonal antibodies are no longer effective, but I think we have good measures in place. Keep up to date with those vaccine recommendations, but also get tested early and, of course, get on the antivirals.
You know, one thing that came out in this week's New England Journal of Medicine, or the week of February 16th, respiratory syncytial virus, RSV vaccination.
Yeah.
For the first time, pretty big breakthrough.
Yeah,
that
absolutely.
RSV vaccines may be effective in reducing disease by as much as 83%. Yeah. For transplant patients, that would be a huge deal. And for all patients.
Yeah, absolutely. And we know that it is the very young, so those under a year, but also the elderly people who are most affected by this. And I think even this year in our hospital, we had more adult patients. But again, the caveat being we are more of an adult hospital. Our patient population is more adults. But it is a significant disease for that elderly population as well. And so that's what these two newest vaccines are really focused towards, to helping prevent severe disease from that. And like you said, over 80% in preventing severe disease, and I think it was over 90% preventing death as well. And that is a very good thing. That is what Dr. Barney Graham originally started to work on prior to transitioning over very quickly into the COVID vaccines. But it is a very good breakthrough, and hopefully will help prevent a lot of morbidity and mortality from RSV in the adult population, whether that's elderly or, like you said, in the immune suppressed population like transplant population.
So not available yet, but I suspect if this data holds true and continues to progress, that we're going to see RSV vaccination, which is a major breakthrough. It causes a lot of disease in kids, and a lot of disease and I know in a lung transplant population and a CF population, asthma populations, RSV is a bad thing.
And I think they are working on a pediatric vaccine, but I think it was one, and then there were those two adult vaccines.
So exciting news breaking through. Last question. There was something that CNN put out there a while back that said if you get COVID, you're good for 10 months.
Yeah.
Yeah, I'm not so sure about that.
Yeah, I mean, it was a good publication. It was in the Lancet, a very respected journal. But we have to take this article and this study for what it's worth. It is a meta-analysis, so it means it puts multiple studies together. I think they did 19 different countries in a span of like 60 some articles about that and research articles during that time. So they compared them all and put them together. But I think it also it is consistent with what we said, as we know that, infection, it will build immunity. You will get immunity not only to spike, which you get from the vaccine, but other pieces of that virus. You will still build up an immunity. And we are hoping, as we have hope, that through time, as our bodies, or especially younger generations, have earlier and earlier exposure to SARS-CoV-2, it won't pose the problem that it has now. Now, a lot of the study was done in the pre-Omicron area. They did have several studies during the Omicron when looking at the ancestral strains, whether that's Alpha, Beta, Delta, and then comparing that to reinfection with Omicron. Certainly that protection was much less, but I think the main importance is that you do mount an immune response. You still do have immunity, you gain immunity to hospitalization and severe disease, even with natural infection. But the thing, Steve, we've always talked about, it's much safer to get the vaccine to help prevent those other problems as well. So overall, good news. Hopefully, as a population, as a globe, we are gaining that population immunity where SARS-CoV-2 won't become the devastating issue that it has been. But you said, like we said, right now, we are still seeing a lot of patients in the hospital. But we know that we can mount some immune response to it and at least some protection to help protect most people against severe disease.
Yeah, best way to stay out of the hospitals, make sure you take good care of yourself, exercise regularly, get vaccinated, whether it's for SARS, CoV-2, RSV, influenza. We can keep you safer. Jess, what do you got going on out there?
Hey, good morning, Dr. Stites. Yes, a few questions from our community today. Joe Ellen wants to know, how do our guests define fit and active for those over 70? How do they measure that?
That's a great question. Dr. Shaw, I'm listening. I'm getting close.
So for in our world, I prefer to do 6-minute walk distance test. It's kind of a very rough estimate how fit a person is, how a person's cardio metabolic activity is. We make patient walk for 6 minutes and see the distance covered. Generally speaking, excellent physical capacities if they are able to walk more than 380 meters. About 300 is good. 250 to 300 is average, and below 250 is poor. And that's what we did when I saw Jim. I made him walk for 6 minutes. He did excellent.
So it's a medical definition, but is there a lifestyle definition? How much should you recommend that somebody is exercising on a daily basis? And I know that changes. We could do a whole program just on exercise recommendations in the elderly. Actually, we probably should do an entire program on exercise recommendations in the elderly. But what do you look for in the heart transplant patients outside of when you test them, Dr. Shaw?
At least half an hour of cardio. That could be treadmill, that could be bike, that could be walking every day is excellent. And that's what we look into.
That's what I tell the lung patients. You need to do 20, 30 minutes every day, at least 6 days a week. And if you can't go very fast, I don't care how fast you go, it's the fact that you went for a while. And once you get up to 20 minutes a day, then you can start going a little faster. But start slow, just get it done. All right, Jess.
Steve is asking the doctors if they think that this research on age might actually apply to other kinds of procedures besides heart transplants.
Dr. Danter, you're the procedure guy.
Yeah, I mean, I think that the take-home message is that age should be considered a relative contraindication to any procedure. If you think about it, there's probably no other procedure other than transplant in some form or other, liver, kidney, whichever organ that you're talking about, that is more strict about assuring that you're or ensuring that the people who are undergoing this relatively scarce gift are in a reasonable condition to take it. So if you think of expanding in the transplant space, it should logically follow that age should, and for many of us, is just a relative sort of measure of whether someone can tolerate any operation. And of course, if we're talking about, ingrown toenails or brain tumor resection, there are different paradigms and there's different parameters for those different procedures. But on the whole, we should take a look at the person as an individual, and there is a good body of evidence that suggests there is a stark difference between chronologic age and physiologic age. So,
I think the key is we have 40, 30, 40, 50-year-olds who can barely move around successfully. We have 70-year-olds out there climbing 14ers in Colorado, and I think it's what you put into it, you return. And I was on the exercise bike for 30 minutes today. I'll be a much better person, much less crabby. Friday I'll be 45 minutes pushing some weight. Saturday's gonna be an hour and a half. You've got to dedicate yourself to it if you're going to be successful with it. I know Hawkeye spends a lot of time in the gym as well. That's why people like his t-shirts. Jess.
Last question is from Alan. Alan is wondering, other than age, what are some of the other things that might disqualify someone from getting a heart transplant?
Dr. Shaw, I bet there are a few.
Yes, I mean, frailty is important, as Dr. Kenter said. People who are not able to do much pre-transplant had a poor functional status to start with, will not be able to improve their functional status if frailty is too much. Then other organs, if their kidneys are involved, although we can look into heart, kidney, we are doing dual organs, but generally heart, kidney, advanced diabetes, if they have complications of diabetes, eyes, peripheral vascular disorders, weight, because post-transplant patients gain weight. So BMI of 38 is a soft contraindication for us. Then something we call pulmonary hypertension, too very high pressures in their lungs can be a contraindication. Last but not least, active cancer also. If we transplant them, we are not going to improve their quality or their lifespan if they are going through an active cancer.
Yeah. And then also tobacco use.
Yeah, ongoing smoking or other types of illicit
Other types of tobacco use, and
too much
vaping.
alcohol.
Vaping is actually something that we've had to consider as essentially smoking.
Yeah, well, as it should be.
Yeah.
The health impacts of vaping are terrible, and those who think it's safe are just not right. So clearly in this transplant world, I think normally the way we look at it is you shouldn't have other significant end organ disease besides the organ you're being transplanted. If you have bad liver disease, you're getting a heart. That's not such a good combination unless you're going to get a liver and a heart at the same time, or sometimes we do liver, lung, and cystic fibrosis. But normally, you really have to be otherwise healthy. And the older you get, the more important I think that rule becomes. All right, well, this has been a great program today, and I really want to thank Mr. Wagner for being a part of this program and for demonstrating to all of us what it can be like to be fit, healthy, working, and having fun over 70 and being a good cook, although we don't really have proof of the last part. We just have your word on that. So well, hopefully someday we'll get a chance to find that out. Let's get final thoughts from some folks. Mr. Wagner.
Well, I'm kind of sorry I brought up the salmon, but...
No, I love salmon. I just love to mess with people.
Well, as I've always said, I just can't thank the people at KU Med enough. And I always say from top to bottom, from the person that comes in to scan your medical equipment inventory, to the people that bring your food in, to Clinton has been fantastic. Dr. Shaw, Dr. Dan, everybody from top to bottom has treated me fantastic, and thank you very much for that.
Yeah, that's awesome. What a great team. Dr. Shaw, final thoughts.
Yeah, I will focus on the age part we spoke about. With people living longer than in the previous era, I think we should look into elderly people seriously when it comes to advanced therapies, transplant and VAD. We are offering VAD for older patients now if they are otherwise fit. So take home is we want to look into age more seriously advanced people to offer them heart failure therapies.
That is awesome. All right, Dr. Danter.
Yeah, I think from a programmatic standpoint, as we grow, we're able to expand sort of what would traditionally or perhaps in the past not been something that we would pursue. But I think adopting a philosophy of not us, if not us who, is sort of the thrust of this program for heart failure. And it's a terrible disease. It has survival rates worse than almost every cancer, and we have therapies now that are very effective, both in VAD and transplant. So I think that for physicians out there that may be watching in the community, just consider this as a possibility. If you have patients with heart failure, then there are options other than medical therapy. And when people have failed medical therapy, and then basically the people here are extremely receptive at discussing patients and accepting patients to be seen with heart failure. And I think that as we've seen in the last 2 episodes that I've been on anyways, a 78-year-old gentleman who got a LVAD and went back to being an airline mechanic or an airplane mechanic, and then Mr. Wagner here. So there are options for people with failing hearts.
Age is relative. Doc Hawk.
Yeah. No, I think this was a great show, for the specifics of the heart transplant, but also for the general topic of just being fit, being healthy, and it is difficult in this day and age for sure. It takes that conscious decision, but it does start with one footstep, no pun intended, but things like getting adequate sleep. We are always asked about how do I protect myself from COVID, or how do I improve my immune function. This is just overall functioning. And having a healthy lifestyle does, just reading an article, does help protect and reduce your risk of long COVID, but it also helps protects from other adverse outcomes from things like other infectious diseases as well. If you are having that healthy lifestyle, adequate sleep, adequate nutrition, moderate to vigorous physical activity, no excessive alcohol intake, smoking we heard is one of the major ones. Those things will all help improve your outcomes should something happen down the road, such as needing a heart transplant, having to undergo chemotherapy, having a bone marrow transplant. We've heard about Dr. McGurk and his team talking about that. So healthy lifestyle is vitally important. It is difficult, we do understand it, but it also helps if you make that conscious decision and just do one step at a time.
I think we have brought new meaning to the great turn of phrase. You guys all know what I'm about to say, right? Live long and prosper. And it means even more when we hear stories of today. And Mr. Wagner, we are delighted that you have both lived long and prospered. Congratulations.
Thank you.
Jess, back to you.
Dr. Stites, thanks so much. Thanks to all of our guests and to our viewers today. Tomorrow on the Morning Medical Update, our newest installment of Where Are They Now? One COVID patient faced months of severe symptoms. But did her pregnancy play a role in her recovery? We find out Thursday at 8.
I'm Alexis Del Cid. On the next All Things Heart.
There's no way to say thank you. How do you say thank you for receiving a donor's heart?
An epic health journey, all leading up to this moment. Cancer, life-changing surgery, and then a transplant. The multiple battles this woman faced before receiving the gift of life. Thursday at 10 a.m.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcasts. Now, everywhere podcasts are available.